You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about mini dental implants. If you are missing one tooth or all of your teeth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about mini dental implants. My first guest, Dr. Steve Brown, is an expert on the topic. He is the founder of the Mini Dental Implant Centers of America. Dr. Brown, welcome to the program.
Thank you. It's great to be here.
Now, before we get into today's topic, tell me a little bit about your practice. I guess all you do is dental implants, mini dental implants?
Yeah, that's all I do. I focus on mini dental implants. You know, there's no specialty for implants.
As far as dental specialties?
There's no dental specialty for implants. So implants are typically done by oral surgeons or general dentists or periodontists. But that's the entire focus of what we do.
Okay, now it's become mainstream. I mean, dental implants these days. What's driving it? I mean, what's driving the popularity?
Well, you know, there's a tremendous demand out there because there's so many people. Apparently, there's about 20 million people that are edentulous, that wear dentures.
Is that right?
Yeah, and they're unhappy with the situation that they have, and so they're looking for something that might improve their life.
Okay, now your background, your training. How long have you been in and around these mini dental implants?
Well, I've been in and around implants for probably about 10 to 15 years when I first started restoring implants.
All right.
And then now I've gotten to where I place quite a bit of implants. We've done. According to the world's largest manufacturer, last year we did the second most. We placed the second most number. So
you're a busy guy. You lecture on the topic. I mean, you teach dentists from all over the country, I guess, the benefits and how to do mini implant.
Yeah, you know, after all those years of training and study, I was fortunate enough to learn from some of the very best programs, the very best people in the U.S. and abroad. And now all that work, all that experience, all that training has paid off to the point where I can actually share that knowledge and I can help other dentists.
Well, when did you know you wanted to be a dentist? I always ask that to people on the program.
Well, you know, I don't think I ever grew up wanting to be a dentist. My dad was a physician, and I always thought I'd be an athlete or maybe a physician. And I think it was just Providence that brought me into dentistry.
Are you new in college? You just said...
Well, I didn't know until about 6 months before I graduated from college that I'd go to dental school. And I applied to one dental school, and I was accepted. And it's turned out that it's been the greatest thing that's ever happened to me.
Why? Why is it so good? I mean, why do you like it?
Well, you know, a big part of why I like it is actually mini dental implants, because it's just an incredible advancement in dentistry. And with mini dental implants, I can literally change people's lives. How so?
How so? You say change people's lives?
Well, you know, so many people come in and they're wearing dentures, or they are embarrassed by their smile, if they have a few missing teeth. And denture wearers typically tell me that they don't like wearing the goop, that they can't express themselves. You know, they have to cover their mouth when they smile.
Okay.
And when I place mini dental implants, I can either stabilize the denture or I can give them a fixed bridge that doesn't come out. And they tell me it completely changes their life.
What are the different categories of dental implant patients you see?
Well, some people come in and they have a single missing tooth. Okay. And in that situation, I basically can place a mini dental implant and give them a crown in as little as one visit. So they come in, we visit, we learn about their situation, I listen to what they would like to accomplish, learn about their health considerations, and then we go ahead and make financial arrangements, we finalize everything, we take an impression, and then the very next time they see me, I can place the mini implant and the crown in the morning, and they can go home that evening and chew.
Sounds very painful, an implant being placed into the bone.
Well, you know,
is it? I mean, do they say it's painful?
Well, you know, people ask me about that, and of course my patients wonder about that, and it's really intuitive that it would be. But the thing is, with a mini dental implant, it's totally different than a conventional implant.
Okay.
With a conventional implant, you basically have to remove enough of the bone and enough of the mass of the body to actually place the implant. It's totally different with a mini implant. All we do is make a tiny little pinhole, and then we gently rotate the implant in place.
So it's a pinhole. Is that an exaggeration? I mean, it's a pretty small hole.
It's pretty small. It's actually about as big around as a pencil lead. So it's a tiny little hole that we place. It's not.
So it doesn't hurt. I mean, the bone doesn't have feeling. So it doesn't hurt going in, or it does? Well, they're numb, I guess, anyway.
Well, they're numb, and my patients tell me it doesn't. You know, they tell me they're comfortable. And we're very, very concerned about their comfort all throughout the procedure and after the procedure. So if there's ever an occasion where they feel a little discomfort, we want to know about it, and then we deal with it immediately so that we can eliminate it or reduce it.
What are the misconceptions about dental implants? You know, knowing I was going to interview, talk to some people, they say they fall out. I mean, do they fall out? I mean, what's the success rate of them staying in?
Well,
is there a number on that?
Well, you know, studies indicate over and over that there's about a 95% success rate with implants. Of course, implants are more successful when they are stabilizing a fixed bridge or a fixed crown, something that doesn't move. The ones that stabilize a removable appliance are a little bit less successful, but on the average, it's about 95% success rate. There's nothing more predictable in dentistry.
So anyone missing a tooth, you think should get a dental implant or look into it?
Yes, I think so. I think that's the very best option that people can choose. And I think a mini dental implant is the best option of implants as well, because it's minimally invasive. We can accomplish what they want in one visit, and they can go home and be comfortable, and they can chew with that tooth the very day that I put it in.
Is it almost as strong as a regular tooth? I mean, is it like getting your tooth back? You say it is.
Well, you know, I think it's actually better, because a mini dental implant will not decay, it will not get periodontal disease, it's not going to ever need a root canal, and it's not going to get hot and cold sensitive. You know, if you have a missing tooth and you go with a traditional bridge, well, that traditional bridge is going to require that you whittle down those teeth, remove a lot of tooth structure till you just have a post left, and then you cement the bridge in place. Now, you're relying that those teeth never have decay, never have gum disease, never need a root canal, and never break.
All right.
As we know, the reason you lost a tooth is probably because you had gum disease, or the tooth broke, or you had an infected tooth.
Now, a big part you say you'd like to see more of is people missing 3 and 4 teeth. They're out there, they're wearing bridges or partials. Why should they do something about it?
Well,
I mean, if they're fine, why should they get a dental implant and replace what seems to be pretty okay?
There are a number of reasons why they want to do that. You know, number one, if they don't restore their mouth, then there's going to be tremendous changes in their mouth. There's going to be changes with their opposing teeth that they're going to fall down and fill the space that void that's there, and they're probably going to end up losing those teeth. But also, they're going to lose the bone structure. You have the bone structure in your mouth because you have teeth. Your teeth actually stimulate the bone.
Because of the pressure?
Well, it actually stimulates. There's a special kind of bone that's in the mouth. It's called alveolar bone. It's not found anywhere else in the body. And if you lose your teeth, then you lose that stimulation, and the bone just starts to dissolve away. It starts to melt away. And then soon that changes the facial structure that you have.
Now, the other category of dental implant patients, you say, are the people that are missing 3 and 4 teeth. Why a dental implant over a bridge or a partial?
Well, I think a mini dental implant is much more predictable than a typical.
What does that mean,
bridge.
predictable?
Well, I think it's going to be more successful over the long term. They're going to have a better chance that that's going to last a longer time, and they won't have to replace it. Many times people get a traditional bridge and they lose the teeth that support that bridge, and then they end up having to get a mini dental implant or an implant to support a new bridge.
Now, mini dental implants are today's topic. I guess there's 2 types of implants: regular dental implants and mini dental implants. Now, are mini implants as effective? I mean, can they do the job? I mean, could a critic say, I don't know?
Well, critics can say they don't know, but they certainly have been tested. They've been around since the 60s in France, and they've been in the U.S. since 1976. And Gordon Christensen is probably the most well-known research dentist in the world. He places mini implants. He recommends them for his patients. He teaches dentists in their use, and he feels that there's a good possibility that they'll end up replacing conventional implants in the next decade.
Just because conventional dental implants are bigger, more trauma, more downtime for the patient?
Yeah, there's a lot more trauma involved when you place a traditional implant. With a traditional conventional implant, you actually have to remove the entire volume of the implant in bone. So you have to have a hole as big as the implant. So therefore, you need a lot more bone. With a mini implant, that's not the case. We're just making a small pilot hole.
Just kind of poke it in there?
Tiny little pilot hole, and then you gently rotate it into place. It's self-tapping, so it doesn't require as much bone either. So with a conventional implant, there's many situations where you'll need a bone graft, which is time-consuming and costly and uncomfortable. And bone grafts, like anything else in this world, are not 100% effective. So with a mini dental implant, you don't need as much bone. It'll preserve the bone that you have, and you can most likely avoid a bone graft that takes a long time.
So they're half the cost. You say half the cost of regular
That's right.
dental implants. Less expensive.
They're less expensive.
But they're not less effective.
They're not less effective. They're just as effective. They're just less expensive. And they're much easier for the patient. Much easier.
Easier meaning what? Just lower downtime, less pain, things like that?
Well, those are just some of the things. Yeah, there's, because there's less trauma, they're going to be more comfortable.
Okay.
That's just intuitive. And also, because of the nature of a traditional implant, they usually take extensive surgeries.
Okay.
It takes a longer healing time. With that mini implant, you take a tiny pinhole in the gum. They come back the next day when I see them, and you can't even tell the thing hasn't been there for 10 years. It looks like it's been there forever. Yeah. There's almost no healing involved. Because very rarely do you have to make an incision in the gum. You just numb the area, make a tiny pinhole, place the implant, and then put the crown on top of it.
You say the denture wearers now. They benefit the most. We talked a little in the green room. Why is that?
Well, denture wearers, they really struggle. I mean, there are a lot of people that have dentures and they say, hey, I'm doing just fine.
Okay.
Well, in 1900, there were a lot of people that rode around on horses and they thought they were fine. And then Henry Ford came along and made cars popular, and they realized, gosh, I wish I'd done this before. And what I routinely hear from my denture wearers is that, gosh, I just wish I'd done this before. I wish I'd done this sooner. They say that over and over. I wish I'd done this sooner. And there's a lot of reasons for that.
Why? I mean, what do they tell you on the consults? What do the denture wearers don't like?
Well, there are so many things. A lot of them feel that they can't even express themselves anymore. They're not even comfortable, laughing or talking.
What, they think it's going to fall out or something?
Yeah, the denture moves, it's unstable, and they're not confident with it. And so many of them come in and they say, I'm not able to express my personality. I'm around people and they think that I'm angry or mad or upset all the time, and I'm not, but they can't smile. And then others say that, I love to smile, but I have to cover my mouth every time I smile. And then some people tell me that they're just sick and tired of dentures, that their whole life revolves around their dentures.
How so? What do you mean?
Well, it's interesting. When I listen to these the struggles that people have, they tell me that many times they have to plan their meals around when they're going to apply the adhesive.
Is that right?
The glue to their dentures. Yeah. And they tell me that sometimes they have to take a break in the middle of a meal to go and put some more adhesive in.
Okay.
So if they're meeting friends for lunch, they really worry about this. They concern themselves about this. Or if they're in business and they're in a business meeting, they're worried about whether or not that denture is going to start to get unstable. And then I've had many patients that make presentations in their business life or in their public life or community life, and they feel very uncomfortable that denture is going to get
So you don't
loose.
think there are any denture wearers? My father's denture wearer, young, vibrant, 73. I've never heard him once complain about his denture. Are you saying secretly he's living, he doesn't like...
Well, I think that...
Are there happy denture wearers?
Well, your dad, for example, he just doesn't know what he's missing. It's been so long since he's had his teeth, he's pretty much forgotten what it's like.
Okay.
To be able to chew confidently, to be able to speak confidently, to not have something move around their mouth, to not have all that mass in their mouth, and to have to deal with paste, the
You say if there was a try-in period, like, hey, let's try out dental implants for the weekend, they couldn't go back to their denture.
That's right.
You believe that? You really believe that?
I really believe that. If there was a way that I could somehow magically give them a try-in and let them kick the tires and drive it around the block, they wouldn't go back.
So after the procedure, I mean, is this one of those things where they call you and thank you? And
yeah, well, they thank me and they tell me that I've changed their life. They give me a hug and they tell me that, hey, for the first time in years, they can eat corn on the cob, they can eat steak, they basically eat whatever they want. They don't worry about their teeth anymore. They tell me that they don't have to wear that goop anymore, which is the adhesive, which is the glue that tastes so bad. It's sticky. It's hard to clean out of their mouth. So there's a lot of different things they tell me.
Now we're going to take a break, but and I want to get into the specifics because I guess you have snap in, snap out, and then you have fixed. Is that, I mean, are those the basic options?
Those are the basic options. That's right. You can
for denture wearers?
For many dental implants, you can either stabilize a fixed crown and bridge that cements in, that never comes out, that acts just like.
So they get their teeth back.
You get your teeth back. It's the closest thing we can give you to giving your teeth back. There's nothing better right now available to people that dentistry can offer than that fixed, cemented crown and bridge to many dental implant. It feels like teeth. It looks like teeth. It chews like teeth. It opens up your palate so that you can taste like with natural teeth. And some people though choose to go with a denture. It's very affordable. And with a denture, we have the opportunity for people to get a very affordable smile makeover while we're stabilizing.
So a denture that just snaps on Like 4 or 6 implants or something?
That's exactly right. Usually with the lower, we put about 4 implants in, and with the upper, we put about 6 implants in.
So 4 on the bottom, about 6 on the top.
About 6 on the top. That's exactly right.
What about age range? My mother, she's another one. I told her about you, that both my parents have dentures. I don't. But she says she's 73, and she says she's too old.
You know, unfortunately...
Is that too old?
Absolutely not. You know, I actually have a patient that's come in. I had a 93-year young lady come in, and in one appointment, I placed 4 mini implants, I stabilized her denture, and she drove herself home.
Is that right?
So this is a 93-year-old.
Why would a 93, 94-year-old want to get dental implants, though?
Well, you know, they tell me that it's a tremendous improvement in the quality of their life. They tell me that they can express themselves, they're comfortable eating again, they can eat what they want, they don't struggle with the paste. It just gives them confidence. Overall, it's just a tremendous improvement in their quality of life.
But you live in a big state. You think there's millions of denture wearers that they're walking around with dentures and they just don't know about dental implants? I mean, if it's as good as you say it is, why aren't all denture wearers just lining up to do it?
I think there's no doubt they don't know about it. And if they could just experience it. And two, you know, even a lot of people aren't aware of it, and they're not aware of what's coming. You know,
but don't their dentists tell them to do it? I mean, recommend it?
Well, that's the thing about most denture wearers. They don't go to the dentist, so they don't know anything
good point.
about it.
All right.
They don't ever hear about it. They don't know anything about it. So hopefully, if we can just let them know that this is a possibility, this is available, they can come in with their existing dentures into my office, and in one appointment, I can place mini dental implants, I can retrofit their denture, and then I can make them a new denture that looks great and that is reinforced right where the implants are.
Okay, with 4 snap in, snap out. That's the entry level, and then you have something fixed. We're going to take a quick break. We come back. I know you have photos. We'll have time for your photos and some models, and I guess those are job bones over there. Is that right?
Yeah.
So we'll look at those. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, what you need to know about mini dental implants. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about mini dental implants. With us we have Dr. Brown. This is all you do.
This is all I do. I focus on mini dental implants because they're the most amazing innovation in dentistry in the time of my career.
Okay, you're holding, what is that, a job bone?
Let me show you something. You know, we're talking about denture wearers and how valuable mini dental implants are to them. If you were to lose your teeth, this is a model of a jawbone, and this is about what the bone will look like around the time you lose your teeth. And over time, that jawbone dissolves and dissolves. And we've all seen people's facial structure after they've lost teeth, how their jaws, how their mouth overcloses, how their lips sink in, how they basically lose their lips and it distorts their face. That prematurely ages someone. There's no reason for that to take place. That only takes place because they've lost their teeth. If I can get them, the sooner I can get to them, the better it is, because I can put in mini dental implants and they will stimulate the bone and stop that bone.
What about osteoporosis? I mean, if somebody has osteoporosis, they could still
Oh, certainly.
qualify
to
get the...
Everybody after a certain point in their life has a touch or some amount of osteoporosis. And I've done them on 90-year-old patients and 93-year-old patients. I do them routinely on people in their 80s. So with the mini dental implant, it's the least invasive. It's the easiest implant to heal from. So the healing period is very short, and it's easier on their body.
Insurance does not cover this.
That's right. Insurance rarely covers
Medicare, things like that. But
Medicare
this is, I mean, the prices are low.
Oh yeah, it's very affordable. It's very affordable, and we have a relationship with a national financing company that will make this affordable for people. So some of our patients say, look, I don't want to pay any interest. Well, they have interest-free options available. And then some people say, look, I just want to pay the least amount I possibly can. And so then they can choose a plan that extends the payments out maybe up to 8 years.
On your website, I see a testimonial where a woman says, if you don't have the money, find the money.
Well, that's exactly what we hear over and over and over from our patients that have gotten.
But it makes that much of a difference in their life.
Oh, yeah.
Is that what they tell you?
That's what they tell me. That's what they tell me, because they can enjoy chewing again. They can speak with confidence. They can laugh out loud. They just enjoy a stability of teeth that you take for granted. You have all your natural teeth, so you don't know what it's like not to have those natural teeth.
Now we are out of time, but those models. What are we looking at?
Before we go, I've got to show you this. All right, this is a model of a lower mouth. Okay, this is the mandible, and this is typically what we see: very little bone, very little tissue. These are the 4 implants that we place in the mouth on the lower anterior, and then these are the little housings that go inside the denture. And this is what snaps off and on of the implants. It snaps off and on as you take it in and out of the mouth. And on the upper, this is a model of the upper mouth, and on the upper we usually put in about 6 implants. We put in a few more implants because the bone's not quite as strong.
Snap in, snap out. It's pretty strong. I mean, they could eat a steak with that, corn on the cob.
Oh yeah, they eat whatever they want. That's what they tell us. They say for the first time in years they're eating corn on the cob, they're eating steak.
Isn't the upper fine because of the suction created?
It sounds fine, but can you imagine having the roof of your mouth covered?
Okay.
And as I showed you this model before, you can notice that a lot of the palate is cut out, and we can cut out a tremendous amount of the palate with the upper denture if we place in mini dental implants. The amount that we take out is dependent upon the quality of their bone. And before we go, you had mentioned that you can spot a denture from 20 yards away.
Now you say you do cosmetic dentures, so they look really good.
Yeah, we love to customize and individualize each of these dentures for each of our people. Let me show you a woman here that came in with this denture. She didn't smile. She was miserable. She was self-conscious. She wouldn't communicate.
Slanted a little bit on that.
Exactly. It's slanted. It's really unattractive. And then we were able to put in implants, stabilize the denture, give her confidence again that she could chew and speak. But she also loved the fact that she got a smile makeover, an affordable smile makeover.
Looks nice. Doesn't look like a denture.
No, we were able to redesign her entire smile. And we go specifically with what people are interested in accomplishing with that smile, so that we can customize it, the color they want, the shape, the contours. We can rotate the teeth slightly. We can make the central teeth a little bit longer, the lateral teeth rotating them a little bit. We can offset the canine teeth. And then with the incisal edges, natural teeth have worn incisal edges. They're not perfect. They're not all symmetrical.
Okay.
So we can create a little bit of asymmetry that looks like there's just a slight bit of wear, so that it looks very natural, and we can make it a
all right, now we're just about out of time, so you have a few more photos?
Here's another guy. He walked in. He had a very unattractive smile. He's a guy that lives his life without smiling. He doesn't communicate. People misrepresent his true feelings and his emotions, and we were able to with the implants, give him this smile.
Yeah.
And now these teeth are actually.
Now he looks more intelligent than the after.
He looks more intelligent. I'm sure it helps his career. He's probably making more money. His wife's happier.
There's a certain stigma with people that are missing teeth, etc.
Oh yeah, it's really difficult. You have a really handsome smile, and so you've never had to deal with that. But
these aren't dental implants, mini dental implants, by the way.
Good for you. But if you ever need them, you let me know. I'll help you out. But it really is something that has a tremendous impact on people's lives. As we've talked about, it changes the way they schedule and plan their life. It changes the way they communicate with people. It changes the foods that they eat. It changes their tastes. It changes their self-perception.
So ask your doctor. That's your message about mini dental implants.
Yeah, ask your doctor. And if they don't do mini dental implants, then find somebody that does.
Find someone that does.
I think they're a tremendous
So it's not gimmicky then, mini dental implants?
Absolutely not.
They're just as effective?
I think they're the latest, greatest advancement in dentistry. They have a proven track record, and I think eventually they'll probably replace conventional implants.
Half the cost?
Half the cost.
Or approximately half the cost?
That's right. That's right. Approximately half the cost. much less time, healing time. You can use them the day you put them in. We can load them the day we put them in.
So you could eat with them how soon?
Well,
I mean, Denture Wearers watching this, they get their images, their x-rays, or whatever you need. You go in, you get them, then what?
The Denture Wearers that come in and see me in the morning, I place the mini dental implants. I can retrofit their existing denture, and as soon as the numbness wears off, they can use their dentures and chew with them that evening.
And start eating?
Starting that day.
That fast?
And as soon as I put the implants in and retrofit those dentures, they immediately tell me how much more stable they are. They notice immediately the change.
We're out of time. Great stuff. Final message, somebody watching this, Denture Wearer. They think they're fine.
Well, I would invite them to come see us. We'll give them their options. We'll let them know what the possibilities are, and then we'll come up with a plan that fits their needs and their pocketbook.
Well, thank you for coming on the show. Very good. Great information. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can visit our website online at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.